decided to draw some beautiful, encouraging posters thanking the local bus drivers for all their hard work at the moment. She stuck them up on trees near the bus garage that they live by in North London. Now, much to Isabella's delight, they were seen by the bus drivers, who then replied with their own poster asking Isabella if it would be okay to take one of her posters and put it up in their garage, as it cheered them up so much. So Isabella then returned to the tree, ticked the yes box in the poster that had been left for her, and sure enough, one of her posters is now hanging in the bus garage, which is lovely. So Isabella's mum, Robin, we spoke to earlier, and she said that during a dark time, it has been a very special few days.
Oh, it was incredible. It was so sweet. They wrote a message back, and Isabella's little face lit up, and she was so pleased and so proud of her. I think it's such a lovely thing that she's done. And Isabella watches them out of the windows, and we've seen them take pictures of it, and yeah, that makes us feel very happy to see that.
Just finally, if you're on Twitter, make sure you check this out. The Met's Firearms Command Twitter account put up these adorable pictures yesterday. Apparently they were patrolling across Southwark when they came across a distressed baby fox that looked to be in some kind of pain. Members of the public had found this little fox with no sign of its parents anywhere, but the police, they looked after him until a charity dedicated to fox care called the Fox Project could take over. And according to the charity, which they've called the fox Bobby, and apparently he's well on his way to making a full recovery, and once he is able to, Bobby will be reintroduced to the wild so that he can be reunited with his friends. So if you want to see those pictures, they are adorable. It's at MPS Firearms on Twitter. Keep the good stuff coming in. The email address makeadifference.london@bbc.co.uk. The number 0800 731 2000.
BBC Radio London, make a difference.
Good evening, BBC.
See the virus
has been brought in. They can't test for it. They don't know who's got it. The staff don't have protective equipment. And usually they don't deal with people who would be potentially dying without any family around them and needing medical interventions that these homes won't necessarily have. So they are feeling absolutely desperate, and I understand that.
So what are you concluding? Is it local authorities who have dropped the ball on this? Is it the government's oversight? What are you thinking?
Well, I don't want to apportion blame. I don't think that gets us anywhere. What we need to do is work out how we're going to address the situation. And one of the problems we've got is that social care is treated as something completely separate from the health service. So the NHS has got its own systems and its own procurement, so it can buy in bulk all this protective equipment, and it's got national reporting standards, whereas local authorities, both in England and in Scotland and also then in Wales and Northern Ireland, are looking at issues perhaps on a more micro level when this needs to be tackled at a macro level. This is something that is across the country. We've got an illness that is spreading fast and is most fatal to the elderly. We know where the most vulnerable elderly people who are most at risk may be, whether they are receiving care in their own home or in care homes, but we haven't yet targeted them for special help. And that's what I think has been missing. You know, we've got intensive care with special help, and the government's done wonderful work here. But a lot of older people might recover if they got into hospital, but aren't necessarily getting there, or are being left in care homes without GPs visiting. They have other things wrong with them, then pick up another infection. And we don't know who to isolate. We don't know which staff have got the virus or maybe carrying the virus. It is very difficult. There aren't easy answers, and you know, there aren't any sort of winners and losers. It's not a question of a blame game, but it is a question of us as a country recognising that the elderly and the oldest generations are worthy of our attention in ways that everybody else would be as well.
Is it a question of more funding?
Certainly the social care sector has for many years been underfunded. That's because of the way the system works, and that's not just this government. In 1999, the Labour government had a royal commission on how to improve care funding and how to reform care.
Yeah.
Subsequently, there have been inquiries, there have been reports, there's been recommendations and even legislation, but unfortunately, nothing has actually happened. Everybody wanted to kick the can down the road.
Yeah, that's the phrase I was going to use. As a journalist, as an observer, it seems to me, whatever governments over the last 10 to 15 years, that can seems well and truly just to be kicked down the road at most given opportunity.
And it is, in a way, a bit of a poison chalice. You know, any politicians that have tried to grapple with this, especially ahead of elections, have ended up paying a heavy price for it. And that, of course, is not a reason not to do it, but what it does suggest is that we need urgently an independent and cross-party review, select committee, minister perhaps responsible for sorting this issue out, so that we can then move forward to integrate health and social care, so that social care isn't considered something that is second or third class, that only